Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Let's say a woman undergoes a screening mammogram and an abnormal area is seen on imaging. What are the usual next steps?
Right. So whenever we see any abnormality on a mammogram, it is very important to find out whether that abnormality is cancer or not. So in order to do so, the patient would get a call back and they would be recommended to do additional imaging. It would be usually a diagnostic mammogram along with an ultrasound. If the need be, a patient may be recommended to go MRI as well, in addition to a mammogram and an ultrasound. Let us say, based on the repeat imaging, we are still suspicious about the given area, then patients are usually recommended to undergo a biopsy of that area. So these biopsies could be done either under mammogram or ultrasound or MRIs. During the procedure, a needle is placed in the suspicious area and the sample is sent to the lab, where a specialized doctor called as pathologist looks at the cells under the microscope and gives a final diagnosis as to whether this is breast cancer or not. Overall, I would say do not be afraid of mammograms. Of all the women who get mammograms, approximately 10% will be called back for some abnormality, but out of these, I would say less than 0.5% women do eventually get diagnosed with breast cancer. So just because we see something suspicious on mammogram, that automatically does not mean that you have breast cancer.
That's wonderful. Thank you.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.